Welcome back to Wellness for Life. With us is Margaret Aho from the MAHUBE-OTWA Community Action Council, and we're right on Highway 34 East in Detroit Lakes. Hi Margaret, how are you?
I'm great, thank you for having me.
Let's talk a little bit about the Head Start program here that MAHUBE-OTWA offers. This is kind of a unique program, isn't it?
It is, but we have a long-standing history. We've been in the business of early childhood and providing services to families for the last 50 years.
Okay. Who is eligible to participate? Is it open to everyone?
It is not.
Okay.
We have specific guidelines that we follow for families to be eligible for the services that we do provide. And those are set by the federal government.
All right.
Income eligibility is one of them.
All right.
And then there's some categorically eligible. So if a family is experiencing homelessness, or if they have, if they've experienced, or if a child has been placed in foster care, there's some certain criteria that automatically will qualify those children for Head Start.
Now, I know that you're looking for students right now, and we're here in the classroom, and I mean, it really is a kind of a unique classroom too. Lots of different things for the young people to do. What are the age limits, Margaret?
Well, actually, we start with working with prenatal services with pregnant moms who may have a high-risk pregnancy or are a teen parent, which is a high-risk pregnancy as well. And we try to work with them on their health services to make sure that they have a healthy pregnancy, which will lead to a healthy birth.
Sure.
Once the baby is born, then we begin to work with the baby and teaching the parent how to parent and real positive parenting skills on the part of the parent.
You know, when young people come in here, when children come in here, what's an average day like for them? I'm talking the toddlers and the ones that can get up and move around a bit. What's an average day like for them?
Well, there's differences because we run a whole gamut of different program options. But if they come into the classroom that we're sitting in is a classroom that is geared for 3 to 5 year olds. And they'll come in, there'll be a greeting as a whole group, they'll eat breakfast, they'll have some individual play that they will do. All the time the teachers are assessing them on their skill levels to make sure that they are at the developmentally appropriate skill level for their age. We have very highly qualified staff. Most of our teachers have a 4-year degree in early childhood. And then we also have assistants in our classrooms that assist as well. So we run a very high quality program to make sure that children are developing so that they are ready for kindergarten when they get into the public school. So we run a variety of options. We run center-based, we run home-based, specifically for those early Head Start children from birth to age 3, where a teacher will go into a family's home once a week, and then they teach the parenting skills, they work with the child, they assess the child in the home, but then they come together for a once-a-week group activity. We also offer family child care, Head Start services within the family child care homes, and we offer a full day of child care and support the parents in paying for that child care and or receiving service or subsidies that will help to pay for the child care.
The most important question: how do people get involved? How do they get their children into the program?
Well, they have to apply. And I'm really excited because we are just starting to do an online application. And anyone can go to www.mahube.org. And if they click on the Head Start link, it'll bring them right to the Head Start application. It's a very easy application that they can do right online. We get the information and then we will contact them for some additional information.
All right, and I'm sure that if people wanted more information, they could, along with going to the website, stop by and see kind of what you have to offer.
Absolutely, we would love to have anyone stop by our office. We will help them at that point complete the application, or they can call and we can mail an application out to them too. They can call 847-1385 and ask for anyone in our Head Start.
All right. Thank you, Margaret, for being with us.
Thank you for having me. I really appreciate this opportunity.
That will do it for Wellness for Life.
coming up on Wellness for Life.
Hi, welcome to Natural Alternatives. My name is Ernest. I'm the director and founder of Natural Alternatives, and along with 3 other physicians and a host of staff that we have here, we specialize in creating alternative pathways for people to recover from injury, from lifelong pain issues that they have suffered with. And today we're going to spend some time talking about an issue that affects so many people involving the TMJ, or the temporomandibular joint. And this particular area of structure is extremely difficult to treat, in that a lot of the muscles lie within the structure of the jaw, but also into the face and to the neck. And some of the manual techniques that are applied aren't even very effective because you can't even get to these attachments. So today we're going to utilize a machine that we specialize in here in our clinic called an Electracuscope, and we're going to demonstrate with one of our clients how we accomplish addressing and getting at the TMJ, or this entire structural component of the face and the jaw. Many issues that people suffer with, involving headaches, chronic jaw pain, teeth pain, sinus complications, mattery, watery eyes, all kinds of issues that involve nerve roots that encompass this entire jaw and face area can be treated effectively by going after the temporomandibular joint, or the TMJ. So again, bear with, and we're going to go through and address that today. So at this point, what we're going to do is attempt, using microcurrent therapy, to go through this entire structure of the jaw that involves the muscles, as you saw from the charts that we presented here, that work in through the entire jaw, down into the neck, and even into the top of the shoulder, the back of the occipital area. They encompass around the ear. Major groups of nerves and muscles all coordinated together. They affect our facial features, your swallowing, chewing, all these different things. And so many times people have lots of pain and dysfunction. They could have been created by genetic or congenital defects. They could be by injury, nerve pain, so on and so forth. So our goal is to try to affect getting through this entire structure that has muscles and tissue that is overlaid. It's almost impossible. So I've got almost impossible to get to, but I've got a pad set here, and right now the Electracuscope is set up so that I'm going to actually push this current through all these layers of tissue that impact and affect this jaw. And so again, with the current moving all the way through from her forehead, it's running laterally down along the side of her chin and her jaw, I can make this current flow through tissues that we can't even physically get to. You can look at these charts. You could go to any place you want onto the internet and look at charts and locations of the muscles and the nerves that affect the TMJ area, and some of them are literally near impossible without surgery or some kind of major intervention to try to get to them. Here, with an Electracuscope, we have the ability to get to these tissues and work them from both a remote position, but also literally distally and physically right to the site. So beautiful thing about the Electracuscope is the ability to go in and treat, hyperstimulate, heal, and rejuvenate these damaged tissues. And again, they could be for a whole host of reasons. People suffer from lifelong issues involving the jaw, chronic headaches, sinus problems, allergy issues, and they don't realize that many of these symptoms that they're struggling with are directly connected to issues that involve the temporomandibular joint. So again, common acronym is the TMJ, but many people suffer with long-term and lifelong issues that involve this joint. So the most common thing that we deal with in our clinic is the residual effect of people having gone through dental work. Many times after going to see a dentist and having maybe even as simple as a teeth cleaning done, people will end up with sore, painful jaws, and they come into our clinic and we address these issues. The beautiful part about using electrocutherapy and treating the way we did today is a completely painless procedure. All they feel is me going in with the probe and working the muscles and all the nerves and stuff around here, but again, painless procedure, and it helps completely resolve the pain and dysfunctions these people suffered with. So again, even something as simple as a dental procedure can create that. And again, I'd like to give you an opportunity. I know this is not a complete synoptic lesson today of TMJ dysfunction, but I'd love to give you an opportunity to come into Natural Alternatives and see how we can help you, and those of you who suffer with this type of pain.
Thank you for watching Wellness for Life. Brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, CHI St. Joseph's Health Weight Management Center, and Natural Alternatives.